All right. Hi, everyone. And thank you for being here. This is seeing a few of you quite a few times this week. Um, it just happens that we're supporting fires and we have things happening locally as well. So I'm Marcia Hovey. I'm the executive director of Cadre and went down to Los Angeles a couple of weeks ago to support a non-governmental resource hub. So it was not a local assistance center where you'd have government there and nonprofits. It was strictly nonprofits. And we did that partly because historically we have found in California that more people come to a non-governmental hub because they're more trusted, which is, we wish that wasn't the case, but we want to make sure that everybody that needs resources gets them. And so we try to get rid of all of the obstacles. Did I just say, put your name and organization in the chat? Sorry, I'm a little flustered because this PowerPoint took me a bit. All right, so let me share my screen. Let me see if I can find it here. Share. This isn't the prettiest way to start the share, but oh well. Okay.
While Marcia's bringing that up, if you have had any involvement with the LA fires and the response and recovery from those, if you would just put that in the chat, that would be really helpful.
Yes, and feel free to share. Because I don't even know if I can tell you everything in an hour and a half. And if we have to make it a part 2, that's okay. I think we are all going to have a part 2, but the part 2 is going to be how would we put this resource hub on in Santa Clara County. And hopefully you'll see that we need to have some more discussion on that if we're really going to be able to do it. All right. So put your name in the chat, organization in the chat. We're running Otter AI and Zoom closed captioning, which you can turn on the screen if you need that assistance. And if you do have questions, Cindy will be watching for raised hands or questions in the chat. And I'll try to do my best. I'm going to blow through these slides really quickly, but just so that you know, Cadre does always encourage people to download the MyShake app and put it on your phone so that you get advance warning before an earthquake happens. There's more information on our website. United policyholders, we also have a whole bunch of resources to give out related to insurance. United policyholders is an advocate for people that have insurance, and right now they are very active all over California advocating for fire insurance and flood insurance. But we do have a lot of these. I would love to get them into every apartment complex, every real estate office, because if you look at the statistics for Santa Clara County, and it's LA was like this too, it's between almost 50% of the population rents and another 20-something% own their homes outright. And because of the cost of insurance, it's very likely that we could have 75% of our population not have insurance and have something like LA happen. And there are an incredible amount of people in LA that did not have renter's insurance in particular. And renter's insurance is the thing that I really want to promote, because you think the property's okay, so everything will be fine. Well, if everything inside is gone and you have no money, you really are starting over again. And renter's insurance can put you up in a hotel and can provide you other resources until you can find other housing. So really reach out to me and let me get these. I have thousands of them. All right, now where did I go? Okay. Also on our website, we have an earthquake safety video. It's translated into 10 languages. It's a video in 10 languages and written material in 20. And we also have air quality information, which is really good especially after fires, but it is a one-stop shop. You can check all of your air quality needs on our website for all of the different organizations that measure the air quality and provide resources to take care of the public or prepare the public. And same with wildfire alerts. We have lots of translated material there. So going on with why we're all here today is that I want to give you my one person perspective, and this was a huge operation, and so I don't know everything that was going on. And I will find out, but I just thought, well, this is plenty to share right now. So I'm going to talk about the planning of the resource hub and how it was set up, what the layout looked like and how we changed that, how we did crowd control, how we collected data, the challenges and the wins, get your feedback. I hope that you get some takeaways from this because boy, I sure did. So the situation started January 7th in Pacific Palisades. That fire then spread to Eaton, where as of January 31st, which is the most recent data I pulled up on Wikipedia, it was 29 people dead, 200,000 evacuated, 18,000 homes and structures destroyed, and 57,000 acres in Los Angeles County. There's not that, I mean, when you think about that many acres, you know, it was all buildings. It was not, it wasn't open land. So this was a huge impact to them. Now, while the first responders were putting out those fires and we were, and the police were evacuating people and people were being put up in shelters, the other half of disaster response was working in the background. That's the voluntary organizations active in disaster. You see this on the left, that is all of the counties in California, and each one in theory has a voluntary organizations active in disaster. They don't all, and very few of them are funded. So I hope you see from this presentation that it might be worthwhile to keep these people intact on blue sky days so that they can actually ramp up and do something when a disaster happens. And fortunately for Los Angeles, they did have a funded VOAD. But NorCal and SoCal just merged, so it's California VOAD now is the network. We speak on a regular basis to share information. Whoever's having disasters, we listen to what their needs are and see if we have any ideas, if we have any resources to share. And that's what happened with this fire as well, that a lot of resources were mobilized, and a lot of Northern California went to Southern California to help. And when we got there, it was obvious that all of the locals were still kind of in shock. They were not making decisions quickly, but that's what happens when you're in shock. And I was really glad that we were there to be able to provide that support to them and this early in the disaster, because they're going to be there the whole time. So the fact that we were able to kind of get things rolling and let them kind of get their legs under them was really good. So let me see, do I want to say anything else about this? Not right now. So the current chair of the California VOAD is Kevin Cox, who's not even in this picture, but he runs the Hope Crisis Response Network up in the Santa Rosa area. His wife, Valerie, is the far right corner with the long blonde hair. He pulled this together. He held the VOAD meetings, he brought in the resources, and then, people started offering to help. So there were more than 100 organizations involved. This was the the start of the registration table. The first day that we did registration, we had maybe 6 people doing registration. By the time we got to the last day, I think we had tripled that. Because the need was so great and we just couldn't process people fast enough. Some of the logistics, so question?
No, I'm sorry.
Oh, some of the logistics was, first of all, where did we get this building? This building was the 4th floor of the Kaiser Permanente medical building in Pasadena. The floor was not being used, and I think they might have had a few people up there, but they just cleared them out. FEMA made that connection for Hope Crisis Response, and then Kevin took it from there. So, think of all the things, and this was all brought together probably, it started the discussion about a week before we actually turned it on. But we got that site, started to plan the layout, got accommodations for all of the staff that were going to come down, which was mostly in Airbnbs, and I'm sure that we got a discounted price on those. Initially, they ordered 300 chairs and 200 tables from a local rental company, but I'm sure that there were more than that. We needed not only the commercial power from Kaiser, but also standalone battery packs, like one was called Jackery that I saw. Goal Zero is there, and there are others, but things that could run all day without power, because this was a big office space, but it didn't have that many outlets for as many people as we had there. And I'm surprised we didn't blow more fuses, but it worked well. You need lots of extension cords. Everyone that comes is expected to be self-sufficient. So if you're coming to offer services, you're not supposed to be asking for any of this stuff. You should confirm what's being provided and what you need to bring. Because we had a lot of people ask for extension cords for any number of things that we brought enough for our typical size hub, but not for this massive event. Outdoor heaters was an interesting one that this was Kaiser's policy, they didn't allow outdoor heaters. And it was a little chilly in the mornings, and they had security guards that had to stand outside the doors all night because people were coming and going, as well as the line of people started at dark. And so on the 3rd day, all of these outdoor heaters showed up. So they changed their policy. We were very grateful because it was freezing cold outside till the sun came out. You need lots of signage. Kaiser also printed all of the big poster signs. They provided security. There were breakout rooms for counseling. There were meeting rooms. There was a break room that was also like our command post. We had a bunch of interpreters, more than 200 volunteers a day. Food for the volunteers and staff, and food for the clients. And I know the majority of it was donated, but I don't know who was organizing that. But there was always food. The first day, though, we learned a lot. The first day, the hubs that have been stood up in the past, the biggest one I think was 1,500 people total. And so they're all kind of laid back, just, helping everybody and being, giving them what they can to help move them forward. But obviously when you have over 200,000 people evacuated, you can expect that you're going to have more than 1,500 people need resources. And over the course of this 6-day event, we had way more than 1,500 people. So this was everything was maximized. And when we plan now, we need to plan for this size event because of the way the fires are behaving, because of the way floods are behaving, and our weather in general. But on the first day, the people that were waiting in line downstairs there was no coffee service. We had a million details and it just didn't get thought of. And for the next every day since the first day, there were coffee companies that showed up every morning to provide coffee for the whole day. And they brought coffee upstairs to us too, which was very much appreciated. But it was everybody just wanting to pitch in. And I think that was the most important thing, is that all of the local organizations who maybe never had a disaster role, they saw the need and they wanted to pitch in, and we were able, because of this structure, to be able to let them in. So day one, people started lining up at 6 a.m. It was open every day. That the hub started at 10. Day one, so they lined up at 6. Day 2, they lined up at 4. Day 3, they lined up at 3. And day 4 and 5, they were lined up at midnight. And they did not all get service. I found a video clip that I'm going to try to share.
Victims is set to close today. The one-stop shop has offered everything from food to other critical support.
And that closure is leaving some feeling like they're in limbo. KCAL News reporter Cara Finstrom live at the Kaiser Permanente parking lot, where a line is already wrapping around the block. And this spot doesn't open for hours, Cara.
Yeah, you know, we weren't sure what to expect when we got here about 5 hours before the hub opens. You can see the big line behind me, and this just goes on and on. Take a look. I shot some video from my phone just circling the block here. Hundreds of people lined up, all in need of some help. This hub has been providing crucial support to those affected by the fires. It was set up here initially temporarily. It's going to close today, but organizers say they are looking for another spot to provide this assistance. Marco Magayan Jr. is one of the folks here in line, and sadly, you've lost your home.
That's right.
You're here with your mom.
Yes.
What kind of help are you looking for?
So we're looking for just any type of financial assistance, whether it's gift cards, grocery cards, every little thing counts at this point. We've been very blessed as a family to have a lot of outside support, but even supports from other agencies like this go a long way.
And you grew up in Altadena, so you were telling me this is not only the loss of your home, but just your whole sense of community and being.
Yeah, absolutely. We say beautiful Altadena, the people there, the location, it's a very tight-knit community. And at least in my block, pretty much the entire block's gone, so things that you really loved and we sort of took for granted, now it's gone by the wayside. But, Dena, we're strong. It's a beautiful community, beautiful people, and we call Pasadena and Altadena the city of roses, and just like a rose, will bloom again.
And I know you've been looking for aid. You said there's a lot of outlets out there, but it's kind of hard to get it all together. This was a stop. Once you were hoping a one-shop stop.
Yeah, so we heard about this from a friend of ours, so we're hoping we can get as much assistance and support as we can. But we're just, looking at different agencies, social media, different places that we can find this type of aid. So this is one of the main ones we heard about.
Thank you for joining us here this morning. And I can tell you, some of the folks here have been here since yesterday. They got here yesterday, they closed before they could be seen, and they literally camped out here, they're telling me, all night looking for this aid. There are federal agencies here, there are state agencies, and again, they are hoping to move this to another location. We've put out a request to learn more about that, and as soon as we get that information, of course, we'll pass it along.
So you saw all the space heaters there, maybe, as people were coming through the gate into the registration area. And we're very grateful for Kaiser for doing that. One of the things that this video did that it made me cringe, is that they said FEMA and state agencies are here. And there were some, but they were not there acting in official capacity, and they were not wearing any identifying garments because they didn't want anybody to be afraid. And this is part of the issue that I had with communication for this event, which I will talk about later. But it's like we all have to be saying the same thing, or it gets really confusing for people.
Sure, when you say we need to all be on the same message, and that there were local government agencies there that were not identified, that were not wearing jackets. Are you sharing that it's good that those agencies were not wearing jackets because they don't scare people? And are
Yeah.
you saying that the media was oversharing when they said there were local agencies there that maybe?
Yeah, well, they didn't know that. I mean, there was a departmental or disaster resource center for FEMA and state agencies to do registrations in another part of town. There was no one publicized, but you know, they were expanding on what they were saying and wanted to make it sound like there were people here that were really important that were going to help them, and instead of just letting the nonprofits be the important people, they wanted to throw in the government. And it's just you know, we don't do enough PR, I don't think. All right, so you kind of get the picture, and there was inside and outside. We had all of anything that was financial, any gift cards. They had Visa cards and Walmart gift cards and Target gift cards and grocery gift cards, and all those were given out upstairs on the 4th floor. But then there was stuff that people could get downstairs without having to go into the line to go upstairs. So they were walking around, and you saw in the picture, and I have a few more pictures of it, but there was, you know, there were groceries, there were air purifiers, there was any number of things. But I will show you that. But this is my home videos just when I got there. I got there Sunday night, and this was already set up because it was going to open on Monday morning. And so all they had done is laid out a bunch of tables, really with not a whole lot of thought. And this is one of the lessons learned, that we can do this. We know we can do this better, is that we lined everybody up. And then by the time you got all of the people in the room, it got very crowded. And particularly when we put the people that were giving the most money away, which there were probably 4 or 5 organizations that, you know, word got out real fast. Hey, I got 250 here. Hey, I got 1,500 here. And so they always had a huge line, but they were side by side. So we had this crowd of people all jammed together with no good lines. Like there wasn't, you really didn't know after a bit who was next. And so there were arguments and some fights broke out because people said, you know, they cut the line, and we didn't have enough people. The second day, we doubled the number of volunteers that we had, from about 100 to 200. This was the Los Angeles Metro, who gave away $400 bus passes to every individual that walked in, which I think they were one of the ones that paid the most. And then there's their recovery group that I'll talk about later. And then United Policyholders is next to them. And this was cool. I'll talk about it later too, but this, I'm going to pause it for a second. In 2003 in San Diego, there was a fire, and then another fire in 2007. And the families from those groups decided that they wanted to do something for other fire victims, survivors. And so they created this file folder to help them organize all of the things that they need to have organized in order to recover from this fire. You know, so it's got papers from FEMA, it's got receipts for food and hotel stays and everything you can imagine. And I have a QR code that I'll put on the screen later. You can get to the online version of it. But this was just touching. And they sent thousands of them to us without anyone asking. The group now is, now I think they're based out of Sonoma County, but they get donations and they build these and they send them to help the fire victims. I'll tell you, it was just looking at it, it was overwhelming. It's like, if you imagine you just lost everything and now you're looking at this is what it's going to take to put your life back together. It was a daunting task. But that was the end of it. So next. Some policies that we had to try to enforce, and things that we decided on the fly as we were there, not always on day one, obviously, but there were, we had to make sure that everyone knew that you were not allowed to do any photo or video in downstairs, because Kaiser already had that as a policy, and they had things, signs posted, and then the media came in and they wanted to take pictures, and you see that some of them were able to get some, but they're trying really hard not to have the survivors have to be on camera somewhere. And also up in the actual hub, it was, you just aren't supposed to be taking pictures of the people. So I got a couple just to try to give you an idea. Fortunately, on day 2, we had a requirement to wear masks. So most everyone was covered up. So that was a good thing. The masks was generated because it was the peak of flu season, and they had to divide up the shelterees into 3 different shelters. One of the shelter was full of COVID patients. One of them was full of flu patients, and the other one had, was it RSV? I don't remember now, but it was like they had to actually add shelters because there was, we couldn't isolate people, and it was, and we've got Red Cross on here. They might be able to explain more about that, but yeah, it was just a challenge. And then access to the building, who could come in, who couldn't. Kaiser was very strict on anybody that they wanted to be in the building. They had to have an official reason to be there, and they were really good at enforcing that. And even though we had all these checks and balances in place that people weren't supposed to come upstairs unless they had on a wristband and a name badge, people still found their way in without doing those things, without going through registration. And so we didn't accuse anyone of doing that. We just said, oh, gee, we'll have to register you now. But we also, and I was a little disappointed that Kamala Harris was going to come by. And of course, that's not really what you want to have happen in the middle of a chaotic event like this, because it gets more chaotic. But they had their security people come in a day early to do reconnaissance, and they made it upstairs without anybody checking them. So she ended up not being able to come. But for as hard as we were intentionally trying to keep people out of the building, you still couldn't, it still wasn't fully possible. So you had to have multiple checkpoints. So this was that front of the hub down there where that blue tent is. That's where registration was. And then in the opposite side, there was a giant atrium, and then a big warehouse type area that was covered. And that's where all of the additional supplies were given out. There were just a bunch of tables there, and anybody could pretty much come up. You didn't even have to prove you were part of the fire, but you could get all of those resources. And this was, I don't know, when I got there at 7 a.m. or something, I don't know. But I didn't mention that. So we served 12,000 people, and we turned away 12,000 people. That's how big the need was. And even with the space, this 4th floor was over 5,000. Wait, 30,000, hold on. 30,000 square feet. and it wasn't big enough. I mean, there were two things that hindered us. One is the ability to get organizations and volunteers there to actually process the people. Is we hadn't, there were enough resources, we just couldn't get them through fast enough. And then the fact that there was just no more space. So it was people and space. So here in Santa
Marcia-
Clara County, yeah,
Marcia, do you know what happened to the people that got turned away?
they just got turned away. Well, and you saw that some of the people that got turned away on Thursday, or no, Friday, apparently stayed overnight, according to that news reporter, that they've been there since yesterday. So it was not a good situation, and
Why did they get turned away?
because we knew we could only handle about 500 people a day getting monetary. And so the first day, it was really sad because we left them out there all day. The hub closed at 7 o'clock. At 5 o'clock, there were still a couple thousand people in line, and they had to go out and tell them that they were closed for today. And what they did on that day was give people a little raffle ticket stub, which also was easily forged. And they had, if they came back the next day with their raffle ticket stub, they got to come toward the front of the line. But that wasn't the best way either. And we did go on from there. But yeah, it's like where I guess we can rely on FEMA to have those relationships with giant facilities of at least 30,000 square feet, or do we, who on this call says if I called you tomorrow that you could say, oh yeah, we can get that facility. I mean, the county has a lot of facilities, but then it's in a government building, and that was what we were trying not to do. So we need some more private partners that have big spaces. And just, no commitment, but if we need it and you say we can help you, then that would be great, than to not even be in the communication loop. This was just the organizations that participated. Some of them were specifically from Southern California. Some of them are national and international organizations. And I know they're scrolling by fast because there's a lot. Parents Anonymous, I had not heard of before. I thought that was fun. But yeah, we were trying to find things that made us a little bit, that made us smile at least once in a while. So we did have voluntary agency liaisons there from FEMA and Cal OES. They were not in uniform. They did have, like, FEMA had some FEMA pamphlets and things out, but they weren't staffing a booth, and there was nothing that said FEMA. And then the California liaisons, as well as the FEMA, they were doing an incredible job of doing translation, because, we had people come in that spoke mostly Spanish and English, but then there was quite a large amount of Armenian. And so they were translating for each other because we had trouble, but we did eventually find a couple of Armenian translators. Suchi Foundation, I can't say enough about them. And UMCOR, I mean, I probably shouldn't just pick out one, but I'll show you a couple more things from Suchi. It's like they know what they're doing, and they're in our backyard. Their office is up off of Oakland Road. They have a huge facility there, and they do so many things and have so many capabilities. And they're right here, and they're a great partner for us. And so it was just, I never got to really see them in action, and just watching everything that they did at this hub was quite impressive. So part of bringing everyone in was you have to register them. And the goal was that they could register for this event, and then they would be in a system, a common system that all service providers would be able to access in a shared way, so that they could see what each other had already given people to make sure that it was as equitable as possible and to avoid duplication. Because in the past, we have had events in our county, starting with the 2017 flood in San Jose, where there were a lot of organizations giving out dollars and giving out gift cards, but there was no common system. And so they'd come to meetings and say, oh, we gave 300 people gift cards. And then another group would say, we gave 400 people gift cards. And it's like, did you give them to the same people? Is there anybody that didn't get gift cards because they didn't know that this was happening? And so back then we started working with San Jose to try to find a common system. It never materialized, but Cadre always kept it in the back of our mind and did study some of the systems. So when the SCU fire and the CZU fire happened in 2020, there was not a lot that Cadre could do in Santa Clara County. So I started attending the meetings of the Santa Cruz Recovery Group. And between the two of us, we were able to pull the money together and decide that VisionLink was the system of choice to create a common operating picture. Cadre signed an agreement with VisionLink because we were the only nonprofit that was playing in that sandbox. And so we were the only one that could actually sign a contract. And so since 2020, Cadre has had VisionLink and shared it, partnering with the Hope Crisis Response Network, and they use it. They've used it for the Boyles Fire, the Mosquito Fire, the Monterey floods, the Park Fire, the San Diego fire. I mean, we've used it all over the state. That was the intention, is because it's a fairly complicated and quite powerful system, but you can't just turn it on the day that the event happens. It takes training, and it takes people that know how to do the data input. It's simple. It's simple to use on the front end for users, but on the back end, it's a little complicated. So we're continuing to, hopefully, we're going to get funding for at least the next year to keep it alive, because Los Angeles and San Diego would like to keep it alive. But it's just probably one of the best things that we ever did was get this system in place, because we can now, we can do so much more for people sooner. And you'll see that, like, when the CZU fire happened, it took a year. There were little pop-up resource villages, but to actually start to do case management and long-term recovery, it took a year before we stood this up. And here, this fire started on January 7th, and we were there on January 25th. And we were already capturing those people and able to get statistics on who they are and what kind of impact it is. And so
Marcia, was there a lead agency responsible for case management?
For this event, well, Cadre, because I went down there because I knew it was going to be big and I knew it was going to be complicated. So I was the lead for the VisionLink interface. Hope Crisis Response was the lead on putting people in the seats to do the registration. And I spent my days fixing things. So I had a little table off in the corner, and I'm getting a little ahead of my slides, but when people went through registration, we checked the map. I'll show you. Well, we'll do that and then I'll explain it. This is the public facing, and this is the beauty of this VisionLink, is that the moment the disaster happens, but everybody, like in Santa Clara County, we could turn it on instantly, but in other places they have to go, well, who is this? What is this? Do we really want them to turn this on? But there was a public facing registration form, and we told, and it got publicized a lot because we have 6,000 entries now. But they can put in their address and what the status of their house was. So we have kind of initial damage assessment. And then they have the option to say, yes, I would like additional assistance from nonprofit organizations. And if they say yes, then they give us their name, how many people in their family, and other things about them, like, how many adults, how many kids, how many over 65, how many under 6, how many pets, do you need help with the pets? And so that, you get a lot of information that can be fed out to different organizations to provide more immediate support and keep people's families intact.
And all that was captured in VisionLink?
Yes, all that's captured in VisionLink. And so this, initially there's name, address. Well, this is when they give permission. Otherwise, we just have their address and the status that they say. And most of them would say that their house was destroyed. Some said we were evacuated. Some said it was smoke damage. But the interesting thing was that when we actually looked at the fire maps, because when we did registration, we looked at the fire maps, and then on the fire map, it would say if it was destroyed or it was okay. Well, there was quite a contradiction in many cases where people would say, my house burned down and the map said it was okay. Well, I have no ability to call them a liar. And I'm not going to, because they wouldn't have stood in line for 5+ hours to come up there if that was the case. So so I got to change people's wristbands I got to escalate them to higher levels of damage, but also what was I going to say? Oh shoot, it'll come back to me. But let me just go on, because it'll come back to me here. So the registration process. So there was pre-registration with VisionLink. Then they had to stand in line to wait to check in. When they checked in, we looked them up by their name. We checked their address on the map, and I'll show you the map. We printed out an ID badge that had their client ID number and their first name only, no last names. And then they got a wristband that said what level of damage. So this was the map, and you had to search. These are CAL FIRE maps, and you search, by address, and it comes up. And when you zoom in real close, you might see 10 that are all red, as in destroyed, and then one right in the middle of them that says it's okay. And for me, logically, it's like, and they're telling me it burned down, and it's like, I wish I had a hotline to someone at CAL FIRE to do some verification for me, because I don't, no offense to CAL FIRE, this is a huge event, but I don't know how accurate it is when you're when you're doing that much data entry. Did you accidentally click the wrong thing? And now I'm telling these people they don't get any services. So we have what they declared was the level of damage, and then what we assessed on the map as the level of damage. And then this was the badge they got. Do you notice anything that could be a problem with that sticker badge?
I do.
Could you go to Office Depot and recreate this? Well, people did. And then when we come up and we go, oh, look, you have the same ID number as someone else. Well, that's weird. Somebody must have typed it in wrong downstairs when they were making the badge. So we'll just register you and give you your own number now. And then you can see the wristband colors. So if they evacuated and their house was affected, it was green. If they had smoke damage, they called that minor, that was blue. Major damage was red, or major damage was yellow, so there was some burn damage. White, if it was a person that was a family member, because only one household was going to get the resources, not every individual family member. And then red for destroyed. Lots of destroyed, but we didn't do any search or sort before we promoted the event. And what we, in retrospect, and what we're going to do for the next one, I think, is going to invite people to come. So we're sorting now the data by destroyed, and we're comparing it in advance with a spreadsheet to the fire map. And then we're going to invite all the people that homes were destroyed to the next hub first, and make sure that they're getting the immediate assistance that they need. Now everyone needs assistance, but we got to triage it somehow, and we didn't. And so people were saying, how come these people with green wristbands are up here and there are still people with red wristbands downstairs? And good question.
So Marcia, Nick Arnett, who deployed with US Forestry, says that they found the same kind of issues with the CAL FIRE maps. And his recommendation is to share that information with the CAL FIRE PIO on site.
Okay. That's great. Yeah, because I mean, it was just, these were all lessons learned. And because we have really not ever done an event this big here, and no one else, I guess, has ever documented what they did in the past. But we're documenting, and working with Cal VOAD, we will be documenting all of this. So there will be at least the start of a playbook, more than we started with. Building security. So they're down there registering. There is this open area that people can wander around and pick up things, but then they're coming upstairs with boxes of food and boxes with air purifiers in them. So that was a problem. But we didn't want them to wait until they got the gift cards to come down, because then their day is much, much longer, because the wait to go upstairs was being except at the very beginning, when we let maybe 50 people up at a time. And then it was, the wait got to be like 5 hours. So one of the things that we did do is, I think on the third day, after they registered, they had to go to a person that looked like they were scheduling fast passes. And I really wonder why we didn't involve Disney in this. But they had iPads, and they would put in the person's client ID and their phone number, and then they would get a confirmation message on their phone that said, we will notify you when it's your turn to go upstairs. And that let people wander around more, and they could take things back to their car, and and gave them much more of a time frame, so that they knew they had 2 hours or 3 hours to wait. So that was cool. So Kaiser had security at the doors downstairs where that sign was, that you saw going into the building. They had security next to all of the elevators. And then we had volunteers in every elevator. And if you didn't have on a badge and a wristband, you were not allowed upstairs unless you had a Kaiser employee badge, and you were only allowed to go to the 4th floor. And then at the door of the resource center, you come out of the elevators, you go down a hall, and then they were checked again, their badge and their wristband, and still people got in. I have no idea how. Not a lot, but it was just frustrating, because we thought we had it pretty dialed. Now, crowd control. Let's go back to that. So here's all these people waiting in line, thousands of people. Kaiser suggested on day 3, and it was the best thing to do. They had green cards, like 3x5 cards, and they were numbered. And they went through the line along with a mental health person or a clergy person or somebody that could help to diffuse situations when people got angry. And they gave out these cards up to 500. And if you didn't get the 500th card, they told you, we're sorry, but that we won't be able to see more than this today. And then these people that have been there, you know, half the night, sleeping there, freezing outside, had to leave. And they, you know, it's not good customer service for people that have just lost everything. But there wasn't another good way to do it. I think that scheduling appointments is maybe going to be a better way going forward. While they were standing in line, we did have mental health and clergy and volunteers going through the line, making sure that they knew, you know, how long the wait was going to be and what was going on and what services were there so that they could see. And then we learned, well, we need to put a sign out that says what services are in here, because they're just coming in. They don't even know what they're going to get. People were frustrated. We had, you know, there were some fist fights because people cut the line or they perceived to cut the line. You know, they're in line for hours and they don't have restrooms. So how do you get out of line to use a restroom? And we did set up porta potties because Kaiser wasn't letting anyone in to use their restrooms. So, you know, they had to set up, and I don't exactly know what they did, but somehow they had people saving places. The other thing that we did not do was we didn't have any phone chargers. And when you spent the night out scrolling through TikTok or whatever you're doing to pass the time, by the time you get up to the registration and you need to show a picture of a bill that's on your phone to verify that your address is correct, that you're claiming the right address, people's phones were dying. And so I had taken my phone charger, so wherever I was sitting, they'd come up and go, oh, my phone's dying. We just plug it in. But you seriously need to have, and I know that there are nonprofits that come and set up charging stations in communities, and we just didn't think to ask. So that's another thing, that when you're expecting lines like this, that you've got to have a way for people to charge their phones. And then,
So there's.
oh, and there were gangs. So we had,
Yeah, I was just gonna say, there's a little bit of a question about, things like, undocumented immigrants and ICE and vulnerable populations like gay and transgender and
yeah,
were there issues amongst those kind of groups?
not that I heard of. The only issue that I heard of, besides people just, you know, trying to block their territory and say, no, you can't go in front of me, was that we did have the two rival groups, the Crips and the Bloods. Members were in line, and so that heightened security, and we had to, they notified the Pasadena police, who came and kind of hovered in the area, and eventually it was just the tension. I wasn't down there, I was upstairs, but they said the tension was just so thick that they asked them to leave. They had the police come and have them leave, which was, you know, that's.
And then just a real general question, what, did you support a particular fire, or did you just support the residents of any of the fires locally?
It was Palisades, Pacific Palisades, and the Eaton. So the Pacific Palisades fire and the Eaton fire, and the Eaton fire was Altadena and parts of Pasadena, all of that. So yeah, we didn't. They're considering this next time doing it by zip code. And inviting people that are closest to the proximity of the hub. But again, it's like, maybe this is a convenient day for you to go, but the day that the hub is open in your area, you have to go out of town or something. So it's challenging.
Like
How are
we
we
need
doing
at
on
least
time?
twice as many hubs.
Yeah. So again, no visible hub presence. This way, I will go faster now. This is the briefing of the providers upstairs in the hub before opening. So this was 1 hour before we opened the hub every day. They got into a briefing because when we realized that we had created traffic jams with, putting the high money people next to each other, we moved them around. And so they'd come in the next day and go, oh, you're over here now. And some of them were not happy about that, but we ended up with a pretty good system. And then some people would come one day and not another day. And some organizations said they were coming and then they didn't. That was bad. That was really bad form to not show up because we had saved space for them, and they didn't call to say that they weren't coming. And so if you commit to one of these, it's a commitment, and you got to be there, but you also have to plan. It's like, this is not an outreach event where you have a pop-up table and or a pop-up tent and one table. You're going to be talking to hundreds of people and nonstop all day. And so you have to have enough volunteers to be able to take that capacity and that surge capacity, I guess. To the left of this picture, there were about 50 chairs there. That was the briefing. So people, once they got their ID check, they sat down there, and then the briefing was given to them in multiple languages, depending on who was sitting there, on how they could navigate the room and which tables would accept their color wristband. The first 2 days, we didn't have that. Third day, we put up colored blocks next to each of the tables so that people could see if this was a place that they would be eligible for something or not. And then if they weren't eligible, then they'd come back to me and say, I need a different wristband. So, but then it went down, let's see, down that hall as far as you can go, and then right, and then another whole room. This was the opening day. And this was just the start of people coming in, because we tried to not have it be so packed that people couldn't be seen. There were, in one of the earlier pictures, you probably saw there rows and rows of chairs front to back. Well, initially we just figured people would sit down there and then wait for their turn to go to each of these tables, but people weren't keeping track of who was there first. And so there were big arguments there too. So we ended up passing out colored Post-it notes. Each organization had a different color Post-it note with consecutive numbers on it. And you gave out the numbers and you called the next number in line, like now serving. And we had a PA system so that you could be walking around the room, going to tables that maybe just had information and no money, and still be able to know when it was your turn, so that you didn't feel like you were wasting your time. But it took people 2 to 3 hours to go through all of the services up here. Okay, lessons learned. So we had to be flexible. We changed it every day. We moved the tables and chairs around. We had to double the number of volunteers, more people on registration, color coded the tables so that you knew which, and gave each of them a list of all of the organizations that were there and what they were offering, because people were shopping. They were looking for money mostly. We briefed the participants, gave them that floor plan. They had to take numbers. We made accommodations for people that were in line. They're back in the line, but they're having trouble standing, or, they're very vulnerable. They were brought to the front of the line and taken in, not on the first day, but, as we got our act together and it got into more of a rhythm, we were able to see things that on the first day you just didn't see because everything was so chaotic. It was organized, but it was chaotic. So cleaning up the data, that's what we're doing right now. And, people are continuing to add into the Vision Link, but the challenges, one is that we receive multiple same name, same address, same email, but then the number of people in the household was different. One was 1, one was 5, one was 3. And it's like, so is this 3 people living in that house? And now we're having to make phone calls to verify that, because you can't just say, oh, that's a duplicate and they put the wrong number of people, because we know in this time people share houses. But anyone that's, not a dependent is another household. So that's been fun. And I've learned that I need some Excel experts to help me manipulate the data. Some things it can't do. It's just the way VisionLink is set up, and we're working with them to make tweaks. Just as we did in real time, they made tweaks to the system while we were there, and they were wonderful. People, we have to make sure they know they need to search for someone before they create a new entry, because there were duplicates just because they just started registering them without seeing if they had already pre-registered. And then now we're doing things like you can only put your email in one time, or it'll get kicked back. So that will help us eliminate this, but it also may backfire on us, because some people are undocumented and their landlords want to do this on their behalf. And so this isn't perfect yet. And I'm happy to entertain any ideas. And then the reports that the providers wanted, that the VOAD, the Los Angeles VOAD wanted, they wanted the zip codes and the reported damage. That was easy. They wanted to know what services were provided by each CBO and how much the value was on a daily basis. That wasn't quite so easy. They wanted to know how many people were served each day. That wasn't so easy. And then, and now they want, they want us picking out pieces of the data that to make us an isolated subset so that they can make calls to those people. So again, I need some Excel spreadsheet experts that might want to learn how to do this and then be available if there's a multi-day disaster going on. Next time we will hand out a list of other places that they can get resources after they're done here. People were panicked because they really thought that there was only going to be one resource hub and then that was it. So we had to keep telling them, no, this is day one. The stuff's going to keep pouring in. So, but if you haven't gone to talk to FEMA yet and get registered in that system, or to get your driver's license replaced or other documents, make sure you go to the FEMA Resource Center. Suu Kyi they have an office down there, and the Red Cross did too. And so they were following up and calling people, or you could go to their office, and then we will have phone chargers, and we will try to take reservations. But I think that our biggest miss was that we didn't tell them where the other services were that they could be doing. And they only had heard about this word of mouth, or, there wasn't a clear path of communication for all of the people. So they didn't all know that this hub was even there. And so we have to do a very, very unified message to the public on where all of the places that they can get supplies. Now, the next hub is March 4th through 9th. I just stuck that there like that, because if you're interested in volunteering down there, you let me know and I will let them know and see if they need you. I mean, I think they need everybody, but I want to address fatigue. How are we doing? Okay. So I was there 6 days. We were up at 5 or 6 every morning. We were in bed by 12 or 1. We ran a 10-hour day of this event, and then we would debrief it, and then we would try to find something to eat. So I would highly recommend, if you have people that are there for a week, that you don't let them work a week. They need to have 3 days on and 1 day off, completely off, and then come back. Because I was watching people, because I was just curious about what's fatigue going to do to us. And you could see people by the 3rd day getting distracted, not being able to make decisions as quickly. And and then on the fourth day, it like happened earlier in the day. And on the fifth day, it happened earlier in the day. So our brains were just shutting down because there was too much. So, and that caused, we were so busy the first day, and food would come. It would go into the break room, but we never went to the break room. So you'd go in and there's no food, and the stores are all closed, and maybe you're going to eat some chips, but that's not a good way to keep yourself conditioned to do this kind of long-term event. People were getting, testy with each other, and we had to stop and remind ourselves that, we're here for some other people, and that this is not a place to, for egos. We just had to calm it down. Dry eyes. I think it was the weather down there, and maybe the smoke, the air quality was not too bad, but it's like our eyes were so scratchy and dry, and people had scratchy throats, and we all thought we were getting sick, but nobody did. Because we were sleeping in these Airbnbs, everyone could hardly move the next day because the beds weren't the most comfortable. So just if you are planning to run an event and you have lots of people, you have to make them take time off, and you really do have to assign someone to go around and tell people to go eat, tell them that the food is there, and rotate them in, because this is a room full of people that they're just compassionate about helping, and they're not thinking about themselves. And then you get to the end of the day and you crash.
So yeah, I was just gonna say, boy,
Yeah,
that was a great
yeah.
transition. I was just
No,
gonna say that the chairman
this
fell
was an
asleep.
amazing treat, is that there was a holistic health school that they brought people every day to offer massage to the clients as well as the staff. Many people took advantage of this. They were like 5 or 10 minute massages. What a difference, though, just to take your mind off the event for a minute. So we need to make sure we're connected with those kind of organizations here, because it's great practice for them. It's a way for them to give back, and they probably never even thought that they were going to have a role in a disaster or recovery. But they were great. We had up to 8 of them there at one time, and it was awesome. Mental health was another thing that the staff were able to take advantage of, as well as the clients. So they had clergy, they had mental health professionals, they had trauma informed mental health professionals, so that they really were good. And then if somebody was melting down in a line somewhere, they would run over there and diffuse the situation, calm them down. People, Salvation Army, Suu Kyi, they were praying with people when when the people asked for prayer. Those 2 rooms in the back, those were both like client rooms, and they put pillows and flowers and little table just to make it like a counseling area. And then the clients would go in there, especially the ones that were really crying a lot. They would just ask them to come in and just take a deep breath and talk them down so that they could be more positive again. So this was huge for everyone. And I think we have a lot of organizations in Santa Clara County that offer mental health. We just need to set a schedule, because everybody can do work here. But the other thing was hugs. I can't tell you how many people I hugged and how healing it was for both of us. I was in line with this, I was talking to the people in line at the Salvation Army, and there were probably 8 of them, and they're tired and they're standing. There were quite a few seats, but they were still standing, and they just looked frustrated. And the lady I was talking to, I forget now, she said something, and I said, "Can I hug you?" And she said, "Yes." And then I just put my arms open. I said, "Does anybody else need a hug?" And I hugged the whole line. They all just opened their arms. So, it's just having that connection and having them know that they're not alone. in what's happening. So it was amazing. Another, we had the Hope Crisis Response Team Comfort Dogs there. So I had to show you a couple pictures of them. I got to stop and visit some of them, but they were there just wandering around every day, and people were, it just makes you smile. And then we had Snoopy there from Knott's Berry Farm, which made the children very happy, and it made us smile too. This was another creative way that people that don't always, they didn't know they had a disaster role, but this church partnered with a laundromat, and they were passing out flyers telling people they could come and do 5 loads of laundry for free, which is something that if you've been through a fire and you need to wash your clothes, this would be an amazing thing. So just practical things that especially the faith community can kind of brainstorm and partner together and do that. And this was the child care area. We had a nonprofit. I can't tell you, I don't remember who it was. They set up this whole area so that when the parents were in the other room, they could send their kids in here for 2 or 3 hours, and there were games and things to play with. The first day they had, I think, 20, and then it died down after that. So I think people, because they had more time, were able to find help. But I think this was just another amazing way that the community came together to support itself. Outside services. So this was downstairs. This was the thing that were happening outside. So Salvation Army was giving out thousands of air purifiers, big, nice air purifiers. And so that was done outside. There were blankets, boxes of blankets. People could just grab them. There was water, all kinds of water and drinks. There were cleaning buckets for people that needed, and this was UMCOR was giving out cleaning buckets and sifters to, I think the Red Cross was doing sifters too, so that they could, when they could get back on their property, they could look for any belongings that might still be there. This was just another overview. So you see how lucky we were that there was this huge covered area, because it did rain only one day. And the weather was decent during the day, but if it didn't have a big covered open area like that, you really wouldn't, I don't know, maybe the fairgrounds, but it was nice that it was out in the air and not confined, especially since upstairs was so confined. Oh, did that already? Oh, am I going backwards? Oh, I don't know what I'm doing. Just another picture. Out behind, you can see some blue vans. This was Kaiser Permanente had a health screening, and so did Suu Kyi. So there were 2 places where anybody could walk up from the outside. They didn't have to stand in line, and they could get health screenings. And there was also pet supplies out there. And that organization I did not meet either, except they had collars and leashes and bags of dog food and cat food and litter boxes and things. But there was an ambulance stage down there, and that was something I didn't mention with the policies. It's like we had a couple of people pass out, or they were diabetic and they hadn't taken their insulin because they had been in line for 7 hours, and and they're just fading. So we ended up first time calling 911, and then as we debriefed with Kaiser every evening, they said, well, we have an ambulance here. It's like, okay, well, do you want that ambulance to be tied up with the EMS call and then bring in another one to backfill, or what's that process? So we straightened that out so that we made sure that we got the closest ambulance coming to help the people. And this was the kind of food that we got. This taco place brought us food, an Italian place brought us food, Chick-fil-A brought us food, and it was upstairs and downstairs. So and there were food trucks that would show up in the lines and just give people food, which was amazing. But I don't know that anybody even organized that or knew who was out there. This was the water that we got from Anheuser-Busch. The water that I think started with the Loma Prieta earthquake when they bottled water instead of beer. And the first time I was sitting and a person came up and set the can down, and I looked, I did a double take because it's like, well, you can't have alcohol in here. Oh, that's water. Okay. But then we were told by the security that we couldn't give them, these couldn't be handed out upstairs because they could be a weapon because they're heavy. Well, so are their water bottles. So, you know, but we have to think about all those things. Here's some of the snacks. Some were healthy, some were not. We ate them all. And sometimes that was dinner. And so this was that binder again. So this is the website. Maybe Cindy could type that into the chat. This is an amazing resource that was developed out of love by a bunch of people that went through fires and know what you need to do to get through it. So this I think there we can request these anytime we have a fire. I think they probably just send them to us because that seems to be what they're doing now. Did you get it, Cindy? Yep. Okay. Okay, here's Suchi. Now this was their tables. They had 1, 2, 3, I think they had 5 tables and so many volunteers that were there doing intake and checking people's papers to make sure that they had a photo ID, and it didn't matter what the photo ID was. It just had to be their picture, and then they had to have a second piece of information that we checked downstairs, but then they checked again upstairs. Second piece of information that had their current address. So if it was a bill, it had to be no more than 2 months old so that we could verify as best as we could. And so they did these briefings of, you know, and they just have such a well-organized machine running there. And I want to show you a video that they did.
Today, we are in the El Monte Tzu Chi Service Center to provide disaster relief assistance for the impact residents around Eaton Fire. Give them a space to come here to share what they went through and what will be the next step for them.
We have been there 40 years. We were the house that hosted every party in the family, baby showers, birthday parties, weddings. You know, it's everything. Someone says, what do you need? I said, everything. We lost everything.
The first house catches fire, and then the wind starts going west, and then it's the next house, the next house, the next house. Then it comes across the street to me. My wife shows up with my father-in-law, my 14-year-old son, and my brother-in-law, and they said, we're gonna help you save your house. And it's pull out water hoses, sweeping the leaves out to the street, just to try to create as much of a barrier that I could. That saved most of my house, which is 40% damage, but it saved everyone else next to me. It gives me a good feeling to know that we were able to at least do that.
I bought that house in 1977. Who knew? 49 years ago, 50 years ago, when I bought that house, this is how it would end. But it hasn't ended because we have wonderful people like Suchi reaching out.
I think the item we're handing out is very necessary to our daily life, and we're here to help everyone to getting the new clothes or other items.
When they come in here, money is important, but the most important now is human touch, a simple, gentle hug.
Oh my God, it was organized, it was caring, made me feel good that there is people in the world that care. I have a lot of positive people around me, and family and friends have been so supportive. So we'll make it through.
So when I met the people from the Tzu Chi Foundation, I didn't expect all that they offered me. The money that they gave me, you know, was a blessing because, yeah, I need it, you know. My deductibles is high on my house, so yes, I needed it, and I was happy that they were able to give it to me. the people that they're here helping out and so much that they're doing for the Altadena community, it's amazing. And I can just say thank you for all that you've done. At some point, I'd love to repay you guys.
We're all in the same boat together. So thank you, Suu Kyi. Help us continue to hope.
And at our event, there were people that received services and came back and volunteered with Suu Kyi. And some other people who were helping with translation came back and volunteered. So it's just such a healing thing to be able to give back and not feel like you're just taking. And then the communication, this is the last thing. So the government, recovery.lacounty.gov, that was their information, and they have everything that you would want to know in one spot for the cleaning up of the property, the debris removal, and the public health concerns. And then I don't know what this slide is. It's probably a mistake. But these are all the people that I wished we had been in communication with. And you would need to have a couple of people that were just information officers staying in touch with all of these. So Government Joint Information Center, we need to all be on the same page, and the same message needs to be going out from everyone. We had people from shelters come to us. So we were in communication with the shelters, and so people were bussed over so that they could get services there. We weren't talking to the FEMA and state people at the DRC, but we had questions about how to retrieve documents, and if we could have called someone, that those questions could have been answered without them having to leave without having answers. 211, all of them. The long-term recovery group, the LTRG, the clients waiting in line. Communication is the number one thing. Everybody needs to be in that loop, and they weren't. There were sub loops, and so you would hear about things, but that's not exactly what you do. And then I put this slide here. This is the Los Angeles Region Community Recovery Organization. This is their long-term recovery group. So I put them last because they're going to be doing this for the next 5 years at least. And so think good thoughts about them. They are receiving donations and will give those out to organizations in the community that need them. Vision Link also has a construction and rebuild module, so we will be bringing in the people that do volunteer building to help with that. So for those of you that just want to keep hanging out with me and Cadre, we're meeting at 10 o'clock on the 27th, which is our normal VOAD meeting. And then we can talk then about joining community support networks if you're not there yet. If you go to cadresv.org/events, you'll see all of the events that we have going on. And that is the end.
Francie had a question about undocumented immigrants in line outside. Did you know of any issues that might have taken place?
We did not. We talked about that, and Kaiser had an ICE policy. They weren't letting anyone on campus that didn't have a reason to be there, and we made it very clear that we were not asking anything about citizenship status.
Yeah, this is Francie. I was just thinking that they might be feeling kind of vulnerable having to stand outside in the line for 5 hours.
We were worried about that too, but
they might not have done it. I mean, so we've never really figured out a good way to to measure who doesn't show up to these things. And I hope we will continue to try to do that because it's going to be more important now. So that was one of my thoughts. And the other one was for people that were more vulnerable physically. And I'm not sure how much they had to stand outside or if there was any accommodations for seniors or, people with physical challenges that just couldn't be
There were
there
a
for
lot
that.
of there were a lot of chairs. There was a lot of seating areas and tables outside, but also the registration people decided if they needed to bring people up because they just weren't going to be able to tolerate the lines. I mean, there was a lot of people that couldn't tolerate. Nobody expected that they were going to be there 6 hours before they even got to registration. Yeah. So
The other thing I heard that some people especially in the beginning, the outreach didn't let them know what documentation they would be needing, so they stood in line for hours and then found out they
yes,
did not have.
yeah.
Um,
So there was, yeah, so that message did not get conveyed uniformly to the public. And so some did not, they weren't prepared with a photo ID and a proof of address. And so we can't give them any money. They can have the things, but that was really hard. And then we have people, this guy that had his trailer on a stable property and he worked at the stable. He couldn't reach anyone from the stable. The stable had burned down and he had moved his trailer. And so he has no proof that he lived anywhere. So we couldn't give him anything. And he just stayed and kept volunteering to pass out donations of stuff. But yeah, it's and that, and this, it's already fading from the news. And those people are not even starting. They're just barely scratching the surface of everything that they're going to have to do to reclaim those neighborhoods and get back together. But it will bond them together.
So Marcia, what kind of ID did they need to provide?
Well, it was any photo ID. It could be an employment ID. It could be a driver's license. It could be a passport. It could be anything from other state. And we did give them a list. We did start publicizing a list, and then we just kept brainstorming for the address because, people said all my bills burned up. Well, do you do online banking? Do you do anything? Do you have a Hulu account? We can look up, we could look up the most recent bill. So that part we were able, and they could call people if their phone was working and get somebody to, do a screenshot of something that they were able to grab when they evacuated. So that it wasn't too difficult, but it would have been really nice for us to have them know that before they got there or check the line. We did start checking the line. Do you have 2 forms of identification? And no, then you're going to have to go because we can't let you in. But yeah, we just need to really work on this whole long-term recovery plan. We can ask Kevin and the Hope Crisis Response Network to come and help us. But yeah, we need to make sure we've got all of our partners at the table here.